pulmonary artery wedge pressure is a procedure performed on the monitor and requires a pulmonary artery pressure line. Before you perform the wedge procedure, make sure the pulmonary artery pressure (PAP) label is set up by confirming that the PAP numeric and waveform appear on screen. To access the wedge procedure, select Main Setup. Use the double arrows to scroll up or down as needed, then select Wedge. When the wedge procedure window opens, the monitor guides you through the steps using prompts, beginning with Ready for balloon inflation. Inflate the balloon on the catheter. Measurements are initiated as the catheter advances into the pulmonary artery. Notice the waveform changes from the PAP to the PAWP wave. Once the application detects that the PAP tracing has changed to a PAWP tracing, the prompt changes to wedging. On completion, the monitor stores the PAWP waveform display and prompts you to deflate the balloon. Note, you can also use Store Trace at any time to store the wedge tracing manually. When the monitor prompts Ready for balloon deflation, the tracing is stored. The pop-up keys have changed and Edit Wedge is available to edit and save the PAWP measurement. The waves in the wedge procedure window freeze and the background is grey. The measured value, where horizontal and vertical lines cross in the wedge waveform, is displayed as the cursor value. You can adjust the lines and the cursor value by using the arrow keys. In this example, we see that the cursor has been adjusted as needed. Store the patient's PAWP value by selecting Store Wedge. The cursor value is stored as the PAWP with a current timestamp. Select X or Main Screen to close the wedge procedure window. The PAWP numeric displays on the screen and is saved to the Vitals Trends database.
Philips